wanting to give 375 milligrams, and this bottle, like I said, you can reconstitute it with several different mils, but I'm going to reconstitute it to make 400 milligrams per mil, which equals, I'm going to add 7.1 mil of sterile water. And so when I did my med math here, I'm going to end up giving 0.9 mils of this medication. Okay, so the first thing I'm going to do, set this down. I'm going to get all my supplies together. Helps if you open it. Okay, and then I'm going to inject 7.1 mils of air into the practice vial, or the sterile water. First thing, I'm going to open both of these, and before I inject the air, I'm actually going to clean them both. And once again, I'm going to just do my second check here, make sure it's the right med that I'm giving and that it's not expired, which is still ampicillin and is still not expired. Okay, so there's that. Okay. So I'm going to put this in and inject the 7.1 mils of air. And I'm going to flip it over here, keeping the needle below. Actually, just okay. I can see it. And I'm going to just, in the sterile water, I'm just going to drop a little bit more because I have some air in there just to make sure that I have enough. Quite a bit of air in there, but that'll be okay because we can waste it. Okay. So I flick it to make sure I get all the air to the top, and then I'm going to waste it till I get to 7 point. This is a bunch of air. And then there we go. A little bit of bubble in there. Okay, and I have 7.1 mils of sterile water that I'm going to inject into my other vial. And so then inject it in there and insert it. And then this will go in the sharps container. And then I'm just going to gently roll this until it mixes and it's a nice yellow. I don't want it cloudy. I don't want chunks still in it. And so like I said, I'm going to give 0.9 mils of this, so then I'm going to get my 3 milliliter syringe. And I'm not 100% sure if I should be using a filter needle to draw this up. There might still be some stuff in there, so just in case, I'm going to use a filter needle and then I'm going to switch it. It's not going to hurt anything, and it'll cover my bases. Okay. So 0.9 mils. Put this in, inject the air, it over. And I'm going to drop this a little bit more because I am the queen of getting air in my syringes. Okay. And then once again, I'm going to waste until I get quite a bit of air. And then there's some fluid to 0.9. Make sure we just push those. Okay. Then at this point, you would never recap a needle if this came off. I would get rid of that. I would switch it to an iron needle. And then I would administer that to my patient using the same method. Okay, so we'll get rid of that. So we're done with that now. So now we're going to give a TB test. So for this, you're going to insert it around 3 fingers below the AC, 3 fingers above, anywhere in here. TB test, you don't have to aspirate. And for the video purpose, I'm just going to drop some sterile, no, not insulin, sterile water. And we are going to give 0.1 mils. Maybe. There we go. I would first clean the vial before my needle was exposed. Okay. And then I would put this on, flip it over. Okay. So again, I got a little bit extra just so I can to 0.1 and verify again. Okay, and for this, we're going to use, so I'm going to insert it at about a 10-degree angle. You don't need too much of an angle at all, because you just want to be able to do a little bubble here. And you're just going to barely stick the bevel with the bevel up, right underneath the skin. And you're just going to make that little bubble. And this would go in my Sharps container. And with the TB test, it needs to be read within 48 to 72 hours. So I would make sure that whoever's going to read it, that we know exactly when we gave it, obviously, so we can read it in the appropriate time. Okay, so the last thing we're going to give for this video is the NPH insulin. And for that, I will have an insulin syringe. This is a high-risk medication, so it's something I want to make sure I verify with another nurse as well, and I want to make sure I have the correct syringe. It's a 100-unit syringe, and I'm going to end up giving 25 units altogether, because I want to give 16 units of the NPH, 9 units of regular insulin. First thing I'm going to do, I'm going to clean the tops of both. And also, for this medication, the first thing before I did anything, I would make sure that the patient's food tray is on the floor and that I have checked her blood sugar. If her blood sugar is low, it would adjust, but if it was low, I wouldn't give it. So I want to make my patient's blood sugar is 250. So it's okay to give insulin. Okay. So make sure I have the correct syringe. I'm going to, let's see, put I like 9 units of air into regular insulin first. Okay. And then 16. would have stuck a needle in, I would have made sure that this vial is mixed properly by rubbing it in between my hands and making sure there's no large clumps or stuff of anything. This is pretty clear because we used a product before, but I would have done that before I did this. And even if I didn't do it before this, I could have stopped at this point, got a new syringe, and started over. 12, 14. Since this is my only syringe. Okay, so I got exactly 16. This one I could have got more because I can expel it out, but with this one I cannot, so I need to make sure I drop this one slow because I can't put fluid back into this bottle. Then I'm going to stick the needle in, flip it over, and 16 I want to make sure I can get to 25. 24, 25. Okay. Perfect. So I would then have Liberty come check this to make sure it's exactly at 25 before administering it. This medication is sub-Q. There's several different sites that you can inject this. I'm going to inject it in the patient's belly 2 inches away from the umbilicus. And with this medication, with sub-Q, you can inject at a 90 or a 45 depending on the size of your patient. With this one, I'm just going to go 90 as well. So I would make sure the needle's back on. I'm going to clean with alcohol. I want to make sure that I also don't inject in the same spot that the patient previously got insulin yesterday or even for breakfast. You want to make sure you move that around. And so then I'm going to I'm going to pinch, slipper, and then I'm going to just do 90 because I'm more comfortable with that. My patient has plenty of fluff. I'm going to stick it in. Make sure you don't have to aspirate this. Inject slowly. Okay. And this would go in my sharps container. So once again, after giving the patient insulin, I would want to make sure we stay on top of her blood sugars, and insulin can bottom them out and make the patient hypoglycemic. And then for everything else, like we gave her morphine, want to check her vitals, but other than that, just monitor my patient, and that concludes everything for this video. Thanks.